Welcome to today's webinar, Payment Integrity Shakeup, Taking AI in a Human Direction. My name is David Servello, as Rachel referenced, and I'm the Vice President of Business Development here at MedReview. And I'll be moderating today's discussion hosted by the Illinois Association of Medicaid Health Plans in partnership with MedReview, a trusted leader in payment integrity for more than 50 years. To help frame our discussion today, we've seen AI has become a bigger part of healthcare operations. Many health plans are asking the same questions. First, what is the role of AI in a comprehensive and best-in-class payment process? And then second, how do we leverage AI to improve efficiency without losing the human expertise and judgment that ensures fairness and accuracy and trust between payers and providers? Joining us to explore artificial intelligence and payment integrity is Spencer Young, as Rachel referenced, CDO at MedReview. Under his leadership, MedReview continues to help health plans across the country, including here in Illinois, ensure claims are billed and paid correctly, supported by medical evidence, and reviewed by a physician-led team consisting of over 350 highly trained professionals encompassing board-certified physicians, registered nurses, certified medical coders, and extensive AI and technological experts, all who bring a deep clinical, regulatory, and coding expertise to MedReview. Good afternoon, Spencer. For the audience members who may not be familiar with MedReview, can you share a brief overview of our organization?
Sure, I'd be happy to. And good afternoon, everyone. And I appreciate the opportunity to speak with you today. And I'd like to take just a few minutes to introduce MedReview to everyone. Our organization has been in business for over 50 years. And during that time, our focus has always been on the review of medical records and attempting to control rising healthcare costs by ensuring the services billed are properly supported by the medical record. Payers turn to MedReview when they need a trusted payment integrity partner to ensure that claims are paid accurately, they're billed appropriately, and supported by the medical records. And one of the main reasons our clients enjoy working with us is because they believe in our collaborative approach to providing leading services that generate measurable returns for our clients. Our solutions are mostly offered on a pre- and post-pay basis, and they include things such as DRG and clinical validation, readmission review, high-dollar claim reviews, hospital bill audits, itemized bill review, data mining, short stay, outpatient, and probably get it. We do a little bit of everything, and so have the whole gamut of payment integrity covered. We work in the government programs doing Medicaid managed care, Medicare Advantage, and we also support commercial health plans as well. And in 2025, we are proud to say that we are on track to save our clients over $750 million in bill pay claims. In Illinois alone, we've identified millions of dollars in improper payments across all lines of business, and we've actually audited and have relationships with virtually every hospital in the state of Illinois. And MedReview understands Medicaid. We have been supporting payment integrity audits in Medicaid managed care for over 20 years. We also understand that each Medicaid agency is unique, and we ensure that our payment integrity program is tailored to the unique nuances and requirements of each state that we work in.
That's great, Spencer. Thanks. And, let's start with the theme of today's discussion, artificial intelligence. AI, OCR, machine learning, generative AI are among the terms now commonplace in payment integrity. Yet for all the talk of AI, everyone seems to define AI, somewhat differently. Can you give us a working definition of AI to help frame today's discussion?
Sure, I'd be happy to do it. I'll start by saying I am no AI expert, but I will do my best based on what I know about it. To me, and when I think about it, AI really refers to the application of complex processes such as machine learning, natural language processing. These are things that enable computers to learn from data and improve their performance without having to actually be programmed to do that. It also gives computers the ability to read and hear text and speech that allows them to understand the meaning of what's being said and to respond appropriately. To me, that's how I think about AI. And then in healthcare, AI is really to help enhance patient care, improve operational efficiencies, and support evidence based decision making, all while maintaining clinical oversight and compliance with regulatory and regulations. In payment integrity specifically, AI is used to identify improperly coded claims for further review. And really, it's being used every year by a lot of different people and vendors. And the funny thing is, a lot of what you hear today about AI is just a lot of fancy marketing or rebranding, and it's companies just using that same algorithm or query they've been using for years, and now they're suddenly calling it AI. But right now, our industry is really at an inflection point in terms of AI. At MedReview, we believe that AI is a tool. It is not a final decision maker. And this belief is evidenced by recent legislation in California that prevents the use of AI to make adverse clinical determinations, and similar legislation that's under consideration in at least 15 other states, including in Illinois. And we're seeing more and more that regulators and payers are focused on how organizations and their partners are integrating AI into their operations. The opportunity is using AI within guardrails to make humans better and faster at what they do, not to replace them. Because when AI runs unchecked, there's serious consequences. It can reduce key human skills such as critical thinking. There's a word called de-skilling or cognitive offloading that occurs when we rely too much on tools, and that really removes that critical thinking component. A good way to think about it is if you think about calculators. I mean, if you're like me, but early at school, there were no calculators, and when they came out, you weren't allowed to use them. You had to do all those complex math problems by hand. You ask most people today to solve some complex math problem, they wouldn't be able to do it by hand. They use a calculator or plug it into Chat GPT and get the answer to it. That's really what de-skilling is. And also with AI, it has this authoritative tone. The way it gives you an answer makes you think it must be right, which kind of leads to lazy thinking is kind of the way I like to think about it. And while efficiency gains are positive, there really is a need to balance automation, because if you automate a whole bunch of junk, in the end, all you have is just a lot more junk. And the other thing is with AI is that false positives are really difficult to remove in settings involving predictive modeling using claims and medical records. In the end, human clinical acumen remains critical in specific areas to verify anomalies, resolve ambiguities, and ensure accuracy, preventing systematic errors that AI might otherwise reinforce if it's left unchecked. Models are always rewarded for providing an answer. You'll never see a Chat GPT say, "I don't know." In the end, they'll guess. And as I said before, because of that authoritative nature, it leads people to believe that answer. And I kind of like to think of AI. It's like that smart toddler, that little 3-year-old that says a lot of things, not really that wise grandparent that has all of that experience and wisdom. So that there's really no question when it comes to AI, governance and oversight really do matter.
Yeah, I love the comment on smart toddler. Been there, done that. Sorry, that's interesting. Spencer, MedReview's been in the space for over 50 years. How have you seen the role of technology and now AI evolve over that time?
Yeah, so there's been a lot of changes in technology over the years. When I first started in payment integrity and we were doing medical record reviews, You would open up a medical record in a document management system and you literally had to scroll page by page by page, hunting, pecking, looking for that information that you were trying to find. And then it really wasn't all that long ago when we started to OCR the medical records. And then once you did that, a little search box popped up, sort of like Google, and you could go in and type something and it would pull up what you were looking for. And everybody thought that was so amazing. It was the best thing yet. And we all felt so empowered now that we could search a medical record and not spend so much time hunting through it. But now today, we have advanced AI, things like genetic AI, LLMs, and all of this technology is just advancing so rapidly with the potential to process just millions of claims at just a matter of seconds and expose really interesting fraud screens. And it provides really big promises in the space of PI for agentic AI with limits. Everything has to have limits. AI machine learning offers the ability to process data at a scale that a human just can't do. And this significantly reduces labor-intensive administrative workloads. And everyone's using it, both patients and payers. And it's funny, you get a payer now that might deny a claim or deny an authorization for service, and the patient simply just goes into ChatGPT, types it in, and it tells them exactly how to appeal the decision back to the payer. So it's being used on both ends, and it's really a matter of who has the best AI today.
It's interesting. So many vendors are chasing full automation in this process. Yet MedReview's leaned into a human in the loop model, a model that seems to be gaining traction in other industries. What prompted that decision, and how do you shape that philosophy? How do you let that shape your philosophy for the company?
Yeah. So right now, in terms of AI, the stakes just really can't be higher in how you use this really great tool. I mean, decisions on healthcare dollars directly impact patient care. They risk delays in care. They add stress to people, and unchecked errors and denied cares. They spark lawsuits and public and regulatory scrutiny. And context is just really essential. In healthcare, documentation is not natural language, and algorithms can miscontext and misinterpret those clinical nuances. And many payers already get burned in this space. I think all of the big payers out there have used AI in some way or another around prior auth and claims payments. And you've seen all of these headlines about, oh my God, AI denied everything and no clinician looked at anything. And now there are all these class action lawsuits against a lot of different organizations because of how they initially tried to use AI. And they were thinking about it the right way because they were trying to speed things up so that people could get answers much quicker. But in the end, it was kind of goes back to what I said earlier. They let it go unchecked, so to speak. So a human in the loop is really a necessity because the clinical notes, the imaging reports, the nuanced coding, they often require, human interpretation to ensure the context and that the clinical judgment are not lost in translation. And the complexity and change is really great in healthcare. And AI and machine learning, that's one of the things it struggles with is complexity. There's constant coding changes, medical tech advances, and new clinical information are always evolving, which is highly challenging for technology that really relies on historical data. And so human adaptation is essential. The fraud schemes, compliance requirements, they're constantly evolving. And while AI is powerful, human reviewers are critical because they can train AI to recognize these new patterns and apply updated regulations far faster than just automation alone can do it.
Yeah. So let's talk about that a little bit more from the practical side of AI and patient integrity. You've said that at MedReview, data and AI are powerful tools,
Yep.
not the final decision makers. Can you explain how that belief influences you and how you use AI in claim reviews?
Sure. So, that belief is really what defines how we use technology across all of our payment integrity programs. At MedReview, we spend a lot of time thinking about what is responsible use of AI. What does that look like? And how do you make it work in the real world? And what does it actually mean in practice? And while human in the loop usually refers to decision making at the end, human input is critical throughout the entire loop. And what does that mean? It means in the very beginning, when you see the data, the machine learning, it goes and it abstracts, it labels the data, and you need somebody to validate that it's actually doing that difference. Because when you're looking at like clinical values, there's a big difference between a 3 and an 8 or a 30 and an 80. And so you need to make sure that what it's abstracting is actually correct. And it's really that abstraction and that human input. It's really what informs and trains your models, and that structure creates that continuous feedback loop back to the model, so that human feedback and QA are really vital to improve the system, as the model is still, it's just code.
Yeah.
And through human audit of outcomes and logic, the system continues learning over time. And unlike some vendors who kind of see AI as a way to replace people, we see it as this is how you empower people. We believe that AI should be used carefully and strategically to create efficiency, not to make clinical decisions. That's why our model is built around having a human in the loop. And what does that mean in practice? It means that we use AI today. We use it to identify and flag the claims that we think are mispaid. And then the AI sorts through all that noise in the medical record, and it pulls out just that pertinent information that's necessary in order to make a determination. But that final review, that final decision, is always done by a human clinician. That means every single clinical determination is reviewed, approved, and documented by a human with clinical or coding experience. And this combination of technology and human expertise really allows our clinicians to work faster, to be more accurate. And in the end, that helps everybody in the process. And this is one of our biggest differentiators at MedReview. It's measurable, it's defensible, and it delivers real value to our clients. Our appeal overturn rate averages less than 5%. And that's just a clear sign that our human in the loop approach produces better, more accurate outcomes. And this approach delivers 3 things to our payer partners that they value the most: accuracy and defensibility, regulatory alignment, and provider trust.
All right, so it's an integral part of what we do. Where have you seen AI make the biggest impact, and where does it still require that human oversight to prevent errors or bias?
Yep. So, and it has made the biggest impact in the areas of efficiency, prioritization, and pattern recognition. The parts of the PI process where speed and scale really matter the most. And as we talked about before, healthcare is an area of just really rapid change, and AI systems can be difficult to move and adapt appropriately and quickly. New scenarios present big challenges to models that rely on shorter term learning or historical data to predict novel conditions. And a really good example of this is if you think about the COVID pandemic. At that time, a lot of payers and actuaries, they were already using AI. They were using it for projecting pricing, what enrollment should be. And then the pandemic hit, and the models got everything wrong. Who could have predicted that everybody was going to lose their job and enrollment was going to drop so rapidly. And then you had this period where the plans were making tremendous amounts of money because nobody could go to a doctor or get services. And then when things started going back to normal, then all of a sudden you had all of these pent up services that everybody was going back for. It was a surprise. You saw all of these earnings reports from these big companies where they got hit by the MLRs because the models were not able to predict what was going to happen. That's the limitation of where you put something new into a model and it just can't handle it because it has nothing historical to bounce it against. So the healthcare landscape, it involves constantly evolving coding changes, technical changes, and advances, which is just really challenging for technology, like I said, that primarily relies on historical.
So I want to spin back a little bit when you talked a little bit about unchecked AI. It sounds like governance is really needed.
Yep.
Can you share what safeguards MedReview's got in place to ensure that AI never overrides that critical clinical judgment?
Yep. So first of all, we've established cross-functional governance as it relates to AI, and AI oversight belongs to everybody in the organization. It starts in our compliance department, it's in our document management, it's in our clinical teams. It's AI governance isn't just an IT thing or a vendor thing. It belongs to everybody. It ensures that our policies reflect that this very broad accountability within the organization. And so, what are some of the things that we have as our overriding factors in our governance? One is that AI augments, does not replace. What does this mean? It means that the AI use should augment and assist, freeing our staff to focus on higher value work and complex clinical judgment. Other thing we say is validate automation and audit the logic. So that means we're always looking at the logic. We're looking at the triggers that are influencing our audit program. You have to remember that automation without validation is a very fancy version of guessing. Maintain scope and adaptability. So we intentionally rotate non-flagged cases into our systems so that we can try to catch things the system might overlook. And so we marry a lot of domain expertise with technology expertise so we can quickly recognize new fraud schemes and regulatory changes. And then you have to prioritize transparency and ethics. You have to mitigate bias with high quality data and prioritize explainability. You can't permit guesses from models, and you have to apply human oversight to monitor the feedback loops. And finally, you have to ensure compliance and uphold accountability. This means you have to recognize that speed does not guarantee accuracy, and speed without accuracy is very dangerous.
Got it. So, Spencer, now let's focus on the human in the loop, which is a holistic approach to AI. Maybe this is how and why humans are so important to the AI process. Let's discuss how this approach translates into value for payers. MedReview integrates physicians and nurses at every stage of the process. Why is that level of clinical oversight so critical to what you do?
And that's really simple. Clinical oversight is what keeps payment integrity fair, accurate, and compliant. And data is great at identifying patterns, but it's only that clinical judgment that confirms the truth behind these patterns.
So you've maintained a 95% plus appeal upheld rate. Really, really extraordinary. What's behind that success, and how does your human in the loop model contribute to that success?
Sure. So first, just to explain what that means, an appeal uphold rate refers to the percentage of all of our clinical review determinations that we receive an appeal on that get reviewed by an independent reviewer, and they agree with the initial decision, meaning that we made the right decision the first time. What this metric really speaks to is the quality and defensibility of the work that we do. It demonstrates that the rigor that we put towards claim reviews through our human in the loop model produces outcomes that are able to stand up to any challenge.
So some of the things I hear when I'm talking to folks is health plans often struggle to balance integrity with their provider relationships. How does your approach, combining AI with physician oversight, help maintain that critical provider trust and collaboration?
So, the AI helps us define those potential errors. It's the clinicians that ensure that those findings are fair, that they're accurate, and that they're explainable. And in the end, transparency is what builds trust. And it also reduces the provider operations, as providers don't always agree with all of our findings, but they actually respect and trust that the decision was made by a qualified medical professional or peer, not some algorithm.
Yep.
And this is what strengthens the collaboration while protecting the integrity of the program.
Got it. So let's connect your approach to outcomes. MedReview has identified tens of millions of dollars in improperly paid Medicaid claims here in Illinois and hundreds of millions national. How does AI help you drive those results?
Yep. And so, and short answer to that is just that our results are driven by these smarter analytics and this stronger clinical validation process. AI helps us to find the potential errors, and then our clinicians make that final determination. They ensure every recovered dollar is medically and contractually defensible. The human in the loop process ensures that what we identify as an overpayment is medically and factually accurate, not just some suspicion that came out of an algorithm. And this leads to preventing false positives and preserving that provider trust.
Okay, so we talked a little bit about improving the process. How do you measure whether AI is truly improving the process beyond just speed and automation?
So at MedReview, we don't measure AI's success by how much it automates. We measure it by how much it improves quality, accuracy, and clinical efficiency without compromising integrity. And also how it improves the value for our payer partners, by delivering higher accuracy, fewer false positives, and faster insights, and that 95% appeal uphold rate. AI succeeds when it helps our clinicians make better decisions. We're not just looking to make faster ones, but better ones.
So let's talk a little bit more about that. Can you share an example where AI has created more efficiencies in the process?
Yep. So one of the main areas or first areas that we really used AI was to help us improve our claim logic. And that's the logic that we use for selecting the claims that we want to have a little closer look at. And traditionally, that process relied on a bunch of static rules or algorithms or even manual sampling of claims. Viewers would have to comb through all of these claims and claim data and using this criteria. They often missed, really complex patterns or maybe even some subtle inconsistencies in data. By integrating AI and machine learning and selection logic, we've been able to analyze far more claim attributes to detect subtle anomalies than just rule-based systems. When you think about a claim, oh my gosh, there's hundreds of thousands of combinations of claim attributes. You think about all of the demographic information, the diagnosis codes, procedure codes, length of stays, present on admission, and discharge summaries, and just everything there is. There's just way too many combinations for somebody to really pick up patterns in one particular combination, but AI can't. And so that's really, that's what's been amazing about it. And this result has been a significant increase in efficiency, making our claim selection smarter, not just faster. And it also allows our staff to focus on those most meaningful reviews.
Got it. All right, let's turn a little bit more and bring it closer to home for our Illinois audience. Illinois Medicaid plans are under pressure to balance cost containment, compliance, and fairness. How does MedReview's model help achieve that critical balance?
Yeah. So the Illinois Managed Care Organizations face pressure to reduce costs without losing buyer trust. And the Illinois Comprehensive Medical Programs Quality Strategy Policy document, published by the Illinois Department of Healthcare and Family Services, HSS states they're committed to maintaining the highest standards of program integrity on behalf of all Illinoisans. And as we talked about earlier, our human in the loop approach is proven to support our payer partners' program integrity initiatives by improving accuracy, reducing false positives, cutting provider abrasion, and delivering defensible determinations.
So, Spencer, you touched on that MedReview's perform payment integrity reviews in all 50 states. Specifically, what technology lessons have you learned from other Medicaid programs that could be transferred to the Illinois folks?
Yep. And I think one of the biggest lessons we've learned is the same thing that a lot of companies are learning today with AI, and that's that technology alone is not a solution or not the solution. It's the combination of data intelligence, the clinical context, and regulatory alignment that really delivers sustainable results. And this approach drives accuracy and savings and maintains fairness and transparency. And all of these things are increasingly mandated under the new AI state oversight laws that are emerging across the country and in Illinois. And our experience across a lot of diverse Medicaid environments has taught us how to tailor the technology and that clinical oversight to each state's regulatory and provider landscapes, so that the integrity and the compliance can move forward together.
So, continuing on that vein, as more states, including Illinois, begin to regulate AI transparency in healthcare, how do you see those laws shaping the future of payment integrity?
And so we really look at these laws, like such as one in California and the ones that are emerging in many other states, like Illinois, as both necessary and positive for the future of payment integrity. States are sending a really clear message that reinforces what we're already doing today, what we've already put in practice. And that's AI use in healthcare can be a really powerful tool, but it must be used responsibly and with final human decision making into every decision. It should inform people. It should not be that final decision.
Got it. Well, as we're moving towards the end here, let's move. Let's look forward a little bit. Where do you see AI and payment integrity heading over the next 5 years, and how will MedReview continue to lead that evolution responsibly?
Yeah, and that's pretty easy. The future in payment integrity isn't more integration. It's really more accountability. And over the next 5 years, we're going to see a shift from speed to transparency, from algorithms to explainability, and from automation to partnership. And MedReview is really prepared to lead that evolution by keeping humans and clinicians at the center of every AI booking decision.
Finally, if you had one message for the Medicaid plan executives on this call about AI and payment integrity, Spencer, what would that be?
I don't know if we can limit it to one, but I can summarize it.
Take a shot.
Sure. So AI can accelerate processes, but only humans can ensure accuracy. And pairing AI detection with human expertise delivers the best of both worlds. It improves accuracy, it reduces false positives, cuts provider abrasion, ensures every dollar recovered directly supports financial performance. AI should never replace human judgment. Keeping humans in the loop isn't just a best practice, it's the foundation of ethical, effective, and compliant payment integrity programs. The goal is to design systems to sharpen focus and thought, combining speed and scope of AI with judgment, critical thinking, and the compassion of humans.
Spencer, one last question for me, and we'll certainly open it up if there are any questions from the audience. Well, one question we hear often, from health plans is how can they start responsibly integrating AI without losing the clinical control? What advice would you give them?
So before you do anything and you put the machine into your process, start with governance. So the governance piece comes first, not the algorithms. You use AI to assist, not to make decisions. And as we've said, you keep humans in the loop every single step of the way. Responsible integration isn't about more automation. It's about maintaining clinical control and transparency while gaining efficiency.